All right. So, what I want to talk to you today is especially about something very interesting. What to do in a complex case. First of all, what is a complex case? Now, there is no real definition for a simple or a complex case, but just for our understanding, let's say a complex case, and Hahnemann writes about it actually in his aphorisms about cases with many deeper miasmatic layers to it and cases which have been treated with a lot of allopathic medicine. These are very complex cases because the reactions to indicated remedies is very minimal. You might keep prescribing remedies, but there will be no change at all. What to do in such cases? What to do in cases which have a lot of miasmatic background, which has a lot of emotional traumas, which has a lot of allopathic medicines, hormones taken in the past, who have taken a lot of vaccinations in the past, especially in cases where there has been too much of coffee, tea, or substance abuse. These are complex cases. Many of them are autoimmune cases. Many of them are oncological cases. Many of them are hormonal cases. What do we do? Well, the first thing is 153rd aphorism. You want to individualize the case. You want to go in deep and find a remedy for the person. But what I want to tell you something today is something even more refined and something very subtle. That once you start studying such cases, you will realize that the case can have multiple states. You can actually, in a case, see two or three different layers. You can actually see two or three different layers of remedies in patients. And I'm not saying this in every case, I'm saying probably in about 25-30% of very, very complex cases. In these cases, you want to start with the layer which is very prominent. So if you see in such a case, which is a very stuck block case, a lot of hormonal layer on the top, you will start with a sarcode. If you see a case in such a block case with a lot of allergies and gastric orientation, you will think about a bowel nosode. If you're thinking about a deeper miasmatic blot, you're thinking about an anti-miasmatic or even a nosode. In a case where there has been too much of allopathic medications given, let's say, for example, the patient has taken too much of chemotherapy, he's taken paclitaxel for a very long time, you want to then remove the layer with tautopathic, its own taxus baccata, for example. Or if someone has taken a lot of estrogen, you want to give estrogen in 30 potency and remove the layer and then look at the deeper layer coming up next. This is subtly a little different to what Hahnemann said, but it also has similarity to what Hahnemann said about miasms. He also speaks about prescribing on the dominant miasm, and there is some correlation here. So these are a lot of interesting thoughts, a lot of newer thoughts, a lot of refined thoughts. And this is an entire course actually that we are coming up with. And I want to genuinely invite all our colleagues for this. We have invited the best homeopaths in the world to talk about this from different parts of the world. And I want you all to join this. There's a special 25% discount and make the most of it. Thank you.